Hello? Testing?
Well, that's okay.
All right. So we're going to eat the microphone. Do we need to? Okay. Let's do then. That's okay. Sorry for people who are on Facebook Live. We're going to start over because our BOCC
Live stream camera
live
was
stream
not
camera
working.
wasn't working. So we're just going to go over what we just did. Okay, so hi. My name's Alyssa Livengood. I'm the Director of Public Health for Custer County.
I'm Meredith Nichols. I am the Director of Emergency Management for Custer County.
So we're doing a virtual town hall right now so that everybody can get as much information as possible, hopefully through Facebook Live and through the BOCC live stream. This will be recorded and you will be able to look to get this information off of the custercountygov.com website, and it will be posted on the COVID-19 page, which is in the left-hand side of the homepage of the custercountygov.com. So we are doing this right now. I realize that we didn't put very much information out ahead of time that we were going to be doing this, but going forward, we will be doing a virtual town hall every Friday at noon, unless there is further information that needs to be disseminated sooner than that. Otherwise, you can find up-to-date information on our websites, on our Facebook pages, and at places like the library in Westcliff and the post office.
So right now, the current case count in Colorado, there's 144. However, there are 0 cases in Custer County. We haven't had to test anyone in Custer County. No one fit the qualifications for that, but they were tested for flu, and that was positive within that.
So the situation is that COVID-19, which is the human coronavirus, the novel human coronavirus, the symptoms are almost identical to the flu, influenza A and B. So that is coughing, sneezing, and a fever, fever over 100. So also the way to protect yourself from COVID-19 and from the flu are almost the same. Wash your hands. If you cough or sneeze into your elbow and keep it off your hands. Keep your hands away from your face. Don't touch your eyes, nose, mouth. And then if you're sick, stay home. If your kids are sick, keep them home. The best chance we have of keeping this thing under control at this point is physical social distancing. I'd like to go backwards just a little bit and say that this information that we're giving out today is fluid. It changes on a regular basis, sometimes hourly. So the statistics that we give you, the information that we give you is what we know right now, and we'll be pushing out up-to-date information as quickly as we can to the sources that I mentioned earlier. Currently, you might have seen on the news or read on Facebook or somewhere else that the CDPHE has new recommendations for people in the surrounding counties of Eagle, Summit, Pitkin, and I have Summit twice. Eagle, Summit, and Pitkin County. Oh, and Garfield counties. So what that looks like is if anyone, I'm just going to read this from the Colorado Declaration, anyone who has been in Eagle, Summit, Pitkin, or Gunnison counties in the past week should minimize all contact with other people, whether or not they are experiencing symptoms. If you are experiencing symptoms such as a cough, fever, and shortness of breath, you must be isolated for 7 to 10 days after the onset of symptoms. It is only safe to leave isolation if your symptoms are improving and you do not have a fever for 72 hours. Immediately prior to the end of your isolation. Isolation may be longer for individuals who have more severe illnesses or who work in high-risk occupations like healthcare. If you live in Colorado and are leaving one of these communities, you should minimize contact with other people for 14 days and watch for the development of symptoms like cough, fever, and shortness of breath. If you are visiting Colorado from out of state and do not currently have these symptoms, cough, fever, shortness of breath, you can return home and practice social distancing there. If you have symptoms and you are either from Colorado or from out of state, stay where you are. Isolate yourself from others and call a healthcare provider or nurse line before seeking care. Do not fly and do not use public transportation or ride shares. That's information regarding the Colorado counties Eagle, Summit, Pitkin, and Gunnison. What does this mean for Custer County? We all know we have people coming through Custer County from other states traveling to these ski resorts and communities in the high country. They have the county, or excuse me, the state has stopped all lifts in ski areas in Colorado for 1 week. So hopefully that will help slow down some of the traffic going through Custer County. Regardless, we're still going to be getting that traffic. We're still going to have people going out of the county and coming back in that have possibly been infected. We are not trying to create panic or cause a giant scare. We're just simply trying to make people aware. Wash your hands, keep your hands away from your face, and if you're sick, stay home.
So we've talked a lot about social distancing, and that's one of the main ways that we can prevent the spread of COVID-19. So I don't think we've really explained social distancing well enough. So here's the main things to avoid are the group gatherings, play dates, sleepovers for kids, concerts, theater outings, athletic events, crowded retail stores, malls, workouts in the gym, visitors in your house, non-essential workers in your house, and mass transit systems. Places to use caution is while visiting a local restaurant, visiting grocery stores, get takeout instead of dining into restaurants, picking up medication, playing tennis at the park, visiting the library, church services, traveling. But great things that you can do in all of this is take a walk, go for a hike, do some yard work, play in your yard if you have kids, clean out a closet, read a good book, do family game nights. You can do group video chats, FaceTime with your family and friends around. You can check on a friend and check on an elderly neighbor and make sure and see if they need anything. We just want to make sure that we are doing as much as we can to prevent the spread and to really give our health care and our health workers a chance to really protect our community.
So the message from public health today is stay home if at all possible. Do not travel out of the county unless absolutely necessary. What does necessary look like? We're talking about doctor's appointments that cannot be rescheduled, getting medications that you're out of. If you feel like you're going to be running out of medications, there has been a declaration passed that you should be able to get 2 months worth of medications. So try to get those things lined out ahead of time. So far, we do have the opportunity to buy groceries and paper goods and things that we need in this county. So do what you can, support our local businesses. However, be prepared if you need to stay home for 2 weeks. That doesn't mean buy 75,000 rolls of toilet paper. Get what you need for 2 weeks. Okay?
And so another thing, we've seen a lot of questions about the school, and while we cannot speak for the school, I will say that they are looking at the different options and seeing what the other counties around Colorado are doing and what would be the best option for Custer County School. And so they are looking at all the options, just to let everyone know.
At this point, we have thresholds that are set in place that we actually set in place from Custer County, and that have also come down from the state. Ironically, they're essentially the same thresholds. And so far at this point, we have not met those thresholds to close the school for any longer than the regular scheduled spring break. That's something that the school officials are looking at and that we're working together with. So know that that's a conversation being had, but at this point we have not met those thresholds to actually shut school down longer than spring break. So let's talk about businesses, general businesses in Custer County. If you're a non-essential place, you might consider options like online shopping, providing online options for people to have your goods and services. If you're a food establishment, you might look at doing a to-go menu, doing a no dine-in policy, and we're looking at this for about 14 days. We're just really trying to flatten the curve and make it so that the spread of coronavirus doesn't come to Custer County, and if it does, it doesn't peak all at once so as to deplete our medical services that we have available. As far as travel plans, again, this is a public health message. Please do not travel out of the county unless absolutely necessary. Do not fly unless absolutely necessary. Again, what does necessary look like? It might be different for me than somebody else. But consider not flying, not traveling out of the county. If you are returning from out of the state, especially on any kind of public transportation, which means flying, please consider self-quarantine for at least 5 days after returning home. Now, that might not be possible for everyone, I understand that. Keep a close eye on yourself as far as watch your temperature. If you get a cough or a sneeze, a sore throat, at the first sign of anything, please call public health and let us know, and we'll walk through it with you, okay? As far as the Custer County public health recommendations, we're also, like Meredith talked about with social distancing. Social distancing looks like 6 feet between you and another person. Now, obviously, Meredith and I are not sitting 6 feet apart. So what that looks like, if it's people that are outside of your everyday work or your everyday family, try to stay 6 feet away from them. So if you go to a restaurant, which the restaurants in this community are doing a fantastic job at helping with this. Try to keep your family 6 feet away from other families. Keep your work family 6 feet away from other work families, if that makes sense. So Meredith and I have been working together. If I have cooties, she has cooties from the last week. So, so that's what that looks like. Okay. I noticed at Tony's they have tables spread out more last week. Chappie's has information out about, you know, they're not placing people right next to each other if possible. There's hand sanitizer available. You guys are doing a great job. Thank you. We would like for people who possibly can, and many of you already do, but if it's possible for you to work from home or to create a policy where people can work from home, we're strongly encouraging that. This is an issue. This COVID-19 virus is something that's only going to go away if we can do our social distancing. Be cognizant of that, be diligent with that, stay home if you can at all. I feel like I'm the only one doing the talking. So the next issue is the long-term care facilities and assisted living facilities. This weekend we did put a no visitor policy on Valley Assisted Living. This means only essential people in the building, which means staff members, people who are delivering goods that they need for, you know, their daily operations, physicians and mental health providers. At this point, we are allowing Valley residents to go out to essential doctor's appointments, and we're going to keep a close eye on that and see what that looks like, because unfortunately most of those doctor's appointments are out of the county. So we're going to see what that looks like, if we can do some telemedicine, things like that here in the near future. The CDC is recommending no cruises at this point, no river cruises, no oceanic cruises. Stay away from cruises. If you have a cruise planned, reschedule it. That's a hot spot and just a nice little petri dish for COVID-19 to spread, and they just can't keep people quarantined on those. The state of Colorado also this weekend put forth social, more than social distancing, but gathering restrictions. So if you have a gathering that you expect more than 50 people to be at, we are asking that you reconsider that, reschedule it, figure out a way to do it online, or You know, something that I was thinking about, like for churches who have more than 50 members, look at separating into 2 services so that you have 25 in one and 25 in another or whatever. Anyways, it's a recommendation from the state and Custer County that you not have gatherings of more than 50 people going forward. One last thing that I want to mention is I have put some information out that we know has changed over the weekend. COVID-19 lives on surfaces for 3 hours to 3 days, which is different than what we were told originally. So just be aware that it can live on surfaces for up to 3 days. It can live in the air for up to 3 hours. The best way to combat this is wash all surfaces. Anything that's being touched on a regular basis, wash it as much as possible. Clorox, Lysol, chlorine, all of those things are effective disinfectants for COVID-19. So your Clorox wipes, if you want to make a chlorine Clorox solution, you can put it's like a tablespoon of Clorox to a cup of water. So it's pretty strong, but that's effective in killing it.
On that note, I just want to make sure that everyone's being safe in their cleaning, and make sure that they are following the guidelines of of the mixtures. Make sure that you research that before you just put a couple chemicals together. That's pretty important. I would like to say a few things.
Yes, please.
Okay, so today we have drafted a disaster declaration for Custer County. So what does that mean? We don't have any cases in Custer County to date. That's correct. But we are already seeing impacts of this. And so in putting in place social distancing, that's going to be putting an economic burden on our local businesses and businesses around. And so this disaster deck allows documentation for our businesses in town to be able to apply for funding if those avenues open up from this. And so, and not only that, it allows us to have resources as a county and emergency services to have resources allocated to us from the state and different agencies. And so moving forward, that will be signed today and then ratified Wednesday at the Board of County Commissioners meeting. We'll push out more information on that. We just wanted to say it here so that you can understand the reason why we're doing that. There's, again, no reason. This just allows us to have more resources, and it gives our community more resources. So it's not anything massive. It's not something to be concerned about. It's just allowing things in place for us to better serve you all. Any other notes on the deck?
Not on the declaration. One thing that I would like to add on after that, though, is that as the county, we want to model good behavior. We want to model best practices. And so we are effective immediately putting in order to not have any Custer County employees travel outside of the county for work-related county business. That doesn't mean you can't go outside of the county if you work for the county. That's saying if you have a business meeting related to county business outside of the county, you need to either find a way to do that remotely, online, or through a Zoom call, or you're just going to have to ask for meeting minutes and information on the meeting from the leaders. That is going to be set in place at this point for 14 days, and we'll reassess in 14 days and see if we need to extend that. So that being said, from Custer County, the county government standpoint, we are strongly suggesting that all businesses
Follow the same
follow
example.
suit.
Yeah. Before we close, where to get the right information. So on our Facebook page, Custer County Emergency Management, Custer County Public Health Agency. We also have a tab of COVID-19 information on our custercountygov.com website. CDPHE, that's the Colorado Public Health and Environment. And so they have all of the updated information on their Facebook page as well as their website. And CDC website as well.
Yeah, and also the World Health Organization. I have noticed that the World Health Organization, though, has a little bit more like higher level technical stuff. So the CDPHE really has good what to do if I get sick, what to do if I'm not sick, how to keep my kids entertained.
Yeah.
Lots and lots of information. Any declaration that's come through from the state level will also be on there. So this situation about 50 people or less in a gathering, that information can be found on there. And then, like I said, we also have information out at the libraries and the post offices, and we're trying to keep that information up to date as much as possible. Please be patient with us, knowing that we're doing the very best we can. We're putting information out as fast as possible, as accurate as possible. If you have any questions or concerns, please feel free to call me. My cell phone number is 719-458-9211. I'm happy to answer your questions or concerns. Going forward, we just need to band together as a county and stay away from each other. That sounds funny, right?
Yeah.
But seriously, social distancing is going to be the thing that helps us the most in this. So be patient, stay home if you at all can,
Yeah.
and enjoy the sunshine. I know it's supposed to be rainy, snowy the next few days, but spring's just around the corner, so hang in there.
The best way we can be there for each other is to distance ourselves. Check on your elderly neighbors if they're in that more risk population. So if they need the high risk population. So if they need groceries, if they need their medications and things like that, check on them and see if that you can support them in those ways if possible. So thank you for tuning in. Again, we'll be doing this every Friday at noon. And if more pressing information comes about, we'll be pushing that information out as well. Thanks, everyone.
Thank you.